So my name is Mindy Lindahl, and I am here with Carmen. She's going to chat with us for the next few minutes. I am doing a video interview for Advanced Careers in Dental Hygiene, course 301. So Carmen, thank you so much for spending some time with us this morning and taking some time out of your busy schedule. I would love if you would introduce yourself, tell us what your job title is, and where you went to school and what you have your degrees in.
Okay, boy, that's a mouthful. My name is Carmen Woodland, and I am a retired dental hygienist, just of a couple weeks, but I am now working in the field of oral facial myofunctional therapy. I have of course, my associates. I have a bachelor's in dental hygiene. I do have an MBA, master's in business, and I went to school in Sheridan, Wyoming, and University of Wyoming.
That's great. Can you tell me a little bit about what you do in your job, what all of that entails?
So myofunctional therapy is kind of a mysterious career field because it's not very well heard of, although that is starting to change because the box is being redefined in dental and healthcare. It's really a wellness field. So I tell people that myofunctional therapy is like physical therapy for the mouth and face muscles. So I'm the person who helps rehabilitate the oral structures. For people who have that have a frenectomy treatment, some people have snoring and sleep apnea concerns. Some people don't have anything but just basic myofunctional impairment. So that could be a tongue thrust. They could have digestive issues related to that, the swallowing pattern. They could have speech impediment. They could have ortho relapse. They could have a lot of concerns. So we call that myofunctional impairment because they're just not functioning properly. Hopefully that makes sense.
Yeah, it makes a lot of sense. How would you explain your appointments with your patients?
So when I see clients, they have to start with a comprehensive exam, and that does a few things. That builds value for them. They see why they need to have the therapy, and then I use that to build their therapy plan. So I decide whether they're going to be able to get by, with an easier phase of therapy, which would be a phase 1, or if they're going to be advanced needs and maybe need to go into my comprehensive therapy, which is a year long. So that I do that. And then after that, I see all of my clients online because my practice is 100% web-based so that I could see people all over the world and bring them this therapy because it's not everywhere. In fact, it's very difficult to find sometimes.
That's great. So I'm taking it that you're able to make your own schedules and kind of work around your life. That's great. That's great. What education or experience and preparation did you have to go through as a previous dental hygienist in order to have this job?
That's an excellent question. So myofunctional therapy is actually written into the scope of practice for 3 professions: speech-language pathologist, dentist, and dental hygienist. So as a hygienist, that is already, the ADHA already has that in our scope of practice. So with that said, you can do a couple different options. Some people like to pursue a route of certification. The downside with that is that certification comes from one organization who created that certification, and they're kind of their own rule maker. So it's not like the dental board. It's not like a license that oversees that. That's not necessary. So I did not do that. I had already gone to graduate school and got my MBA, so I was already very well versed in the business part of, building this business. And then I did some advanced training with a mentor out of Washington and did my advanced training. So really, I teach a program called the Myo Mastery Program. And so I teach other hygienists, how to be a myofunctional therapist, what you're looking for, how to start your own business, that kind of stuff. So it's not something that you have to necessarily go to school for. You just have to learn the skills and what you're looking for and really how to do the business aside from dental hygiene.
That's great. I love that you continue to kind of share your passion with other hygienists too. That's really nice.
That's because there's really a need for hygienists to know, even if hygienists don't want to be a myofunctional therapist, I travel to dental hygiene schools and lecture to just share about the field of this, that, you know, they're getting ready to take boards. They're not really thinking about 7 or 10 years or 20 years down the road that they might be bored or have an injury, that kind of stuff. But to just let them know that when they meet somebody who has a grade 4 tongue tie, we want to do something more than just note it in their chart. There's some significant consequences of myofunctional impairment. And I feel like hygienists really are the agent of change in the office. So they're the ones that can say, hey, this is a concern. I may not know how to treat it or do anything about it, but be able to refer them to the person who can help. And that's somebody like me.
That's great. And what other practitioners do you work with throughout your myofunctional therapy practice to help make sure that the patients are receiving the most comprehensive care possible?
So it takes a village. So there's a lot of pieces, you know, moving parts to this. I don't work, you know, like there's chiropractic and there's a lot of people do like craniofacial or craniosacral therapy. But the most important practitioners that I work with are whoever's going to provide the frenectomy. So, you know, all dentists are taught this in dental school. That doesn't mean that they're any good at it or that they've done it since then. So that's the real concern is dentists will do it. They'll say, yeah, I can do it. I know how to do it. And the problem is they don't do it right. They're not well trained. They don't understand the implications of not having pre and post myofunctional therapy. So I work really hard right now. I'm working on having one person in every state that does it my way, that they know my protocol, they know my practice philosophy, and I know theirs. So we work really well together. And then also an orthotropic orthodontist. So not a functional orthodontist, not orthodontist like we all know, but an orthotropic really works to grow the face forward. You know, craniofacial growth is really important in this industry, and we're learning a lot more about what's good about ortho and what's bad. You know, cosmetically straightening the teeth, but what about the structural foundation? That's the important part. And airway. So a large, you know, my path of passion here is prevention of sleep apnea because it kills people. And that's my biggest concern. And kids don't know. A lot of times they diagnose children as ADHD, they give them a medicine, but maybe they just need a good night's sleep and parents have no idea. It's just not mainstream knowledge that sleep apnea does not have to be an overweight middle-aged man with a big neck.
Right. Yeah, I love that that's coming into kind of more common practice these days with children especially. Then wrapping up, Carmen, what advice would you give me if I wanted to become a myofunctional therapist like you? How would I get into this type of similar position that you found yourself in?
Excellent question. So you take a training course, and so that can be with somebody like myself. I teach the Myo Mastery Program, which breaks the learning down into individual modules. So it's a lot easier to digest and grasp the information, and I give it to you so that you can put things into action each week. Or you can take other courses. There's programs that offer a 4-day course. My experience so far with my students is that's a lot of information to throw at you and then have you turn and run, you know, build a business and run with that. But getting the knowledge from somewhere is really the basis. So, and that's how I started and then really kind of perfected where I went from there.
That is so great. Thank you so much for your time. I really appreciate it. And
you're very welcome.
I might be sending some hygienists your way.
Well, I would love it. I would love it. We have a new program starting in September, and about every few months there's another program starting. So
that's great. Thank you so much, Carmen.
You're welcome.